Hello and welcome. My name is Armando Nahum. I'm a patient safety advocate and a principal at H2PI, the Healthcare and Patient Partnership Institute. Joining me today is Stephen Faust, a patient and family advisor at Emory Healthcare in Atlanta, Georgia. Hi, Stephen. Thank you so much for joining us today. And if you don't mind, would you be so kind to introduce yourself and your role at Emory Healthcare?
Thanks for having me, Armando. I appreciate being here. My name is Stephen Faust, and I'm a patient family advisor at Emory Healthcare. I've been a patient at Emory for 37 years and at PFA for a little over a decade.
Stephen, I'd like to spend a couple of minutes talking about how Emory Healthcare supports the continued momentum of its Patient and Family Advisory Council, specifically how it has sustained it over time. Emory Healthcare has been such a leader in evolving the infrastructure of your PFAC and how the system uses it. Could you start by briefly describing the Patient and Family Advisory Council structure that Emory has developed? And also, I believe there are multiple PFACs. How does Emory coordinate the work of the different PFACs?
We're actually in a process of reformatting things right now at Emory. Given the pause that COVID has given us, we're taking the opportunity to reset. We've had some leadership changes involving the Office of Care Transformation, which we formerly operated under. Now we're operating under a new director of patient and family-centered care at Emory. And so we're adding a little more construction to it than used to be there. And so we're developing it in three different areas. One is structure, one is communication, and one is education. In terms of structure, we have 7 other councils throughout the Emory healthcare system. Our PFAC is the overarching council that oversees the program. And we are creating a structure now where each of the councils are writing their own bylaws and creating a leadership structure. And then the leader of each of these councils will actually now sit on our main PFAC so that we can establish better communications with the councils so that they know what we're doing as a system and that we know what they're doing as individual organizations. And then we're creating on the staff end liaisons to each of these councils, but then a liaison for each hospital and physician group practice, because not every PFA sits on a council. Some are just independent individual PFAs. So then they will report to the liaison if they're not on a council, and then the liaison reports into the director of patient family centered care and also then into the council. So we're covering communications with that, and we're covering structure with that. And then we're establishing a formal process of educating our PFAs, because we do operate at a high level at Emory Healthcare, and we want our people to understand and be confident of how they should interact at that level.
Stephen, Emory Healthcare's PFAC, I believe they have been in place now for well over a decade. How has Emory sustained the role and energy of the PFAC over time? As we know, organizational strategy evolves and leadership changes and PFAC staff changes, and also PFAC members join or leave. How have they addressed that?
It's a good question, especially because at Emory, we have had leadership turnover. We have a CEO that's been there a little more than 5 years now and a new chief nurse executive. And the PFA program actually falls under the purview of the chief nurse executive. And then, of course, they put in their players that we report to a vice president and a director. So we have had the leadership change, but we've maintained our relevance. And we have to say we appreciate that the leaders that did come in were very receptive to us, even though they didn't have a lot of experience with PFAs. But they understood through their other leaders throughout Emory Healthcare that we were a vital, interactive part of how the system operated and made decisions. And I think, like I would advise most councils, we are advocates. We're advisors and we're advocates. We had to advocate for ourselves. We showed the new leadership that we have value. We documented change modeling that we implemented throughout the system that had demonstrable results, very measurable and very effective. So you have to make sure that you maintain a relevance. Hospitals evolve, leaders evolve, but if you got a thriving program, you stay relevant.
Thank you very much for that, Stephen. Well said. I have another question for you. What advice do you have for others in your position, how to grow and support their PFACs? Now, what are the keys to success in your view?
It's a relevant question, and I think that it gets back to people. You need to make sure you have the right people as PFAs. I like to tell other organizations that I talk to, and even at Emory, I say, we volunteer our time, but we are not volunteers. We're advisors, we're consultants. And so we need to find people that have the right reason for wanting to be a PFA. It's not a place to moan and complain. It's a place to contribute to the change in leadership of the organization to better serve patients, to get better outcomes, better safety, and to progressively address the needs of our patients and families. And I think that that is what maintains our relevance over time. And we also train them how to talk when you're sitting around executive leadership, when you're sitting around a chief medical officer, or when you're sitting around any other person that is a leader in the organization. So our people can work with everybody from a janitorial position to the guy that parks your car, all the way up to the CEO. They're comfortable at every level and they interact that way. And so finding the right person and then educating that person, I think those are the keys.
Wow, well said, Stephen. I thank you so much for your time today. I really enjoyed our time together, and thanks.
Thanks for having me, Armando. I appreciate it. This is a joy in my life. It's my passion, and so I'm happy to share it with other people.